Hello friends, one in every 1,000 children suffer from congenital deafness. So hearing is not about just hearing, it's about learning the IQ of the patient. The way he perceives the entire world is being affected. To create awareness about such a problem, we have Dr. Ramanee joined together with us. So he is a senior resident in the Department of ENT in All India Institute of Medical Sciences, New Delhi. Hello, doctor.
Hi, Dr.
So, even in fact, my uncle was suffering from hearing loss since his childhood. So, his parents were not that aware. They were waiting for the child to speak till the age of 5 years. So, after that, they decided to take the patient to the hospital. At that time, the amount of treatment options that were available were very limited. So, in such circumstances, what is the thing that we can do to detect all these things at an early point of time?
As you said, the incidence of congenital hearing loss is 1 in 1,000 births. It can be detected early by means of screening. Like we have a test called OAE, which is done in almost all the government hospitals and tertiary care centers. Who are eligible for undergoing OAE are the child who are the high risk of hearing loss. If the mother, a pregnant mother, has issues like high BP, thyroid issues, or any sugar problems, or any seizure disorders, or at the time of delivery, if the child undergoes any stress, or the child didn't cry for first 10 minutes, or the child is admitted in ICU. So these kind of children should be selectively screened for hearing loss. So normal delivery does not require screening, but these specific children require screening for hearing loss, and it is done with the help of OAE.
Okay, doctor. So if the mother has a high risk pregnancy, then we screen the children. What if the child doesn't have any high risk factors for having deafness? How the parents can identify the deafness at an early stage?
In case of a normal delivery, normal mother and a normal child, and to detect the child's hearing, it can be done with the help of parents in the home itself. It does not require any special setup. So the parents are educated to see how the child is responding to the sound stimulus what we are giving. Like a normal child at the age of 2 months should respond to hear the sound and respond to the sound. The responses can be turning towards the direction of the sound, or shaking the leg and hands, or just making humming sounds, ha, who, I say, they can make sounds. And then the stimulus. The parents can stand at just 1 feet or 2 feet, and just they can simply clap their hands. So the child should respond to the sound. Or we have some entertainment devices like normal that musical devices which we use to entertain the child. Those also can be utilized for the same purposes. Then if the child is not responding to these sounds, even at the 5 months of age, our child is not making any humming sounds like who, ha. So these kind of children should be again brought to ENT specialist to check for their hearing.
Okay, doctor. So if a child is found to have deafness associated, is there any possibility that some other disease might also be associated along with it?
In any child with any congenital problems, we should look for other problems also which are related. Like in case of congenital hearing loss, the additional thing we have to look for is any thyroid disorders. Okay, the child will have hypothyroidism also, and any kidney disorders become to detect early kidney failure, and then heart issues like arrhythmias, what we say, which is called as weak heart. And the most important thing is language development. If the child did not hear any sound, did not register any sound in his or her brain, they won't reproduce that sound. If they didn't reproduce the sound, then there is no speech. So a deaf child will also be dumb. And next thing will be their intellectual development. So if there is defective or problem with communications, their intellectual ability also decreases.
Okay, doctor. So, if a child is found to have deafness, what are the treatment options that are available?
treatment options which depends upon the severity of the problem the child has. To see the problem, we need to do two investigations. One is called BERA, which is called to hearing test, which is done, and another one is an MRI scan. In BERA test, we'll be seeing how much the decibel the hearing loss the child has. Like in case the child has of almost 75 decibels of hearing loss, so then the child will be prescribed for cochlear implantations. If the hearing loss is little lesser than 70, 65, 50, and these children can be advised for hearing aid or hearing aid trial. So this intermediate group at 60 to 70, they will also given for hearing aid. They'll be given a trial. If they didn't respond, then they also will be prescribed for cochlear implantations. And next thing we are doing is MRI scans. In this MRI scan, we will be looking for the inner ear and then the nerve which is required for hearing. If there is any problem with this inner ear, so then the next option or the last option we have is auditory brainstem implant. So we have three options.
Okay, doctor. So we came to know that there are multiple options which are available. So if a patient is found to be a suitable candidate for cochlear implant, so how much is the success of the surgery?
The success of the surgery, like it's not a surgery, the success of the treatment. So how early we initiate the treatment? Usually, the early the surgery, the good the response is. The earliest the surgery can be done is 9 months of age. The late, the how much time period the surgery can be delayed is up to 5 to 6 years. Because this 9 months to 6 years is the effective period for neurological development. So in this period, the child will receive almost the maximum sounds, and they will register in their brain. This is called as neurological development period, and this is called as neuroplasticity. If the child does not hear any sound in these 9 months or since birth up to the 6 years, then there won't be any registered sound in their brain. So they will automatically prefer the alternative mode of communication, which is called a sign language. So once they started using this sign language, as a mode of communications, these children will have difficult or poor prognosis. The same child with the sign language after 6 years of age, they have comparatively less prognosis. And then the success of the surgery, like cochlear implantations, which also depends upon the speech rehabilitation which you are giving, because we are implanting a device, cochlear implant, which can just pick up the sound and give it to the brain. It is a speech therapy which teaches the child this sound is a noise, this is a music, and this particular sound is your name, and this is the way you have to respond to these kind of sounds. This kind of training will be given in the speech rehabilitation. So a combined surgery plus the speech rehabilitations will produce better outcomes.
Okay, doctor. So what are the long-term and immediate complications associated with the surgery?
Like based on the surgeries, as a short-term complications, actually it is a bionic device which has two parts, like a transmitter and a receiver. This receiver is the part which receives the sound and it gives to the transmitter. This is a transmitter along with the electrode which will be inserted in the inner ear. Okay, because we are dealing with this inner ear, the child has increased risk of brain infections like meningitis. The rate, the chances the child can have is just 0.1 to 0.3 percentage, and these complications can also be avoided by giving vaccines just before the surgery. These are the short-term complications. And then as a long-term complications, and because it is a magnetic device, the child, like when the child is taken up for any security checkups in airport or in railway station, at that time that child can have magnetic interference in the devices. And then when the child is undergoing MRI, so at that time with these MRI signals, the device may get failure. Now the up-to-date implants are very well upgraded and they are MRI compatible, and now we don't face any issues with them.
Okay, doctor. So, what is the usual cost that is associated with this surgery?
As an implant, like, the surgery cost is different. The implant alone costs around 5 to 6 lakhs. And this is a basic model. The prices are different for different implants. A basic model costs around 5 to 6 lakhs. And then additionally, which can be covered under government schemes also, either in the state government scheme or in central government scheme, it can be covered. And if you go to private hospitals, the patient has to pay additional amount for surgery also.
Okay, doctor. So, if the patient is from a rural sector, where are the surgeries usually done so that he can access the treatment options that are available?
These surgeries are usually done in all the tertiary care center hospital, because we need more well equipments which are available in the tertiary care centers and almost all the central institutes.
Okay, doctor. So, we thank Dr. Ramanee for giving such a valuable information and creating awareness about congenital deafness. So, if you have any doubts regarding this topic, kindly leave in comments. We will try to answer that. So, we will see you in one another useful topic. Until then, it's Aravind signing off. Bye. Thank you.
Thank you.
Okay, sir. No